Assalamu alaikum dear students. I am Dr. Mohammad Mazharul Islam, Associate Professor of Community Medicine, Bashundhara Ad-din Medical College. Today I am going to discuss about the research methodology, and today is the second part of my lecture. In my last lecture I have discussed about what is research and how to conduct a research, and we have discussed the steps that are required to conduct a research, and today I would like to elaborate the part how to prioritize a research topic. We know that we have to work on a specific topic or specific subject or against a specific question or specific problem. We have to define the problem or define the question, and first of all we have to prioritize on which problem we are going to conduct the research, because in our daily life or work activities we see that we have lots of problems, lots of questions. We need to know the answer to those questions or need to know the solution of those problems. Problems are so many, but we are going to conduct research on a specific subject. So what to do, which one to pick? So we have to prioritize the topic. For this we have 7 criteria on which we prioritize a topic. Those are relevance, avoidance of duplication, urgency of data needed, political acceptability of the study, feasibility of the study, applicability of the results, and ethical acceptability. Relevance is the criteria that is extremely necessary to select the topic. We have to select a topic based on current situation or the problem that has a great effect on population, like a highly important problem, or the problem must be relevant to the time, place and person, the time in which we are now living, the place in which we are living, and the persons that are relevant to us. And we have to prioritize according to relevance. The problem must be relevant to the people, must be relevant to the time, and must be relevant to the current situation. So important problem must be picked. So relevance is the first criteria for prioritizing a topic. The second criteria is avoidance of duplication. We don't have to conduct a research that is already done by some other people in similar situation or similar field area or similar context. One study may be already conducted by some other persons. We don't have to repeat, because the answer to that question is already discovered by some other persons. So we have to see that by literature review, like studying the journals or newspapers or textbooks, especially journal articles we have to study, and we have to find out that this problem is already solved or not. So we don't repeat any study. The third one is urgency of data needed or timeliness. For example, currently COVID-19 pandemic is going on in the whole world, and we need to know in details about COVID-19. So it is important for this time, and it is necessary and urgently necessary. So timeliness or urgency of data is our third criteria on which we have to consider during prioritizing a topic. Fourth one is political acceptability of this study. Acceptability by the policy makers, not political parties. Acceptability by the policy makers, like national level policy makers are Minister of Health or Director General of Health Services, like this. So they have some programs, they have some plans and strategy. So we have to study on a specific topic which is in line with their plan or their strategy. So policy makers' acceptability is another criteria on which we have to we prioritize a problem. So if we select a topic that is not in line with the current policy makers' strategy, that will not be applicable and that will not help in the current policy makers' plans or programs. So it will not be effective for our improvement of the health service that is being conducted by the policy makers. So political acceptability is important. And number 5 is feasibility of study. We are going to conduct a study. So our feasibility, can we do that? It is possible for us to conduct that specific study, must be considered. We have constraints in resources. Resources are man, money, material and time. Do we have enough manpower to conduct that study? Do we have enough money to conduct that study? Do we have enough materials, equipments to conduct that study? Do we have enough time to do that? We have to consider all these things. This is feasibility. And number 6 is applicability of the result. The result that is obtained by our study is something to be applied. Otherwise, there is no benefit to conduct the study. So we have to see that there is benefit and we can apply the result on the population or any program for improvement of our health service or improvement of the health of the people. So applicability of the result must be considered before prioritizing the topic. And number 7 is ethical acceptability. We are going to conduct a study that must be acceptable to the people on which we are conducting the study. If the study is not acceptable, the study procedure not acceptable, or the questions that we ask to the people are not acceptable for them, we must not do that. We have to take informed consent before conducting the study. We have to take informed consent from the participants. And another is, we have to maintain the data collected from the persons confident. Confidentiality of data is mandatory for any research because it is their personal data, their personal information. We do not have the right to expose their personal information to other people. So we have to maintain confidentiality of the result or data. So ethical acceptability is very important. It must not be harmful to the persons, must not be humiliating to the persons involved. So ethical acceptability is another important criteria to be considered before selecting a topic. So these 7 criteria are the matters to be considered before prioritizing or before selecting a topic. And this is end of my second lecture on research methodology, and inshallah we are going to discuss about literature review in my third lecture. Assalamu alaikum. Allah Hafiz.